followed the work of our next presenter for years, and I'm thrilled that she's able to be here to talk with us today. Dr. Heidi Hartmann is a feminist economist and the president of the Institute for Women's Policy Research, a scientific research organization she founded in 1987 to meet the need for women-centered, policy-oriented research. Dr. Hartmann is often cited as an authority in various media outlets, such as CNN, ABC News, the New York Times, and the PBS NewsHour with Jim Lehrer. Today, Dr. Hartmann will speak to the current economic outlook for women in the United States and discuss why women continue to be disproportionately affected by poverty. Please join me in welcoming Dr. Hartmann.
Good morning, everybody. It's a pleasure to be here. And I don't know if I can live up to the great expectations that have been voiced for me. But let me also say it's a pleasure to be here at an event where Diana Pierce's pioneering work is being recognized. Thank you, Diana. And Diana is just one of many friends in the social work community. In fact, is Mimi Abramovitz here? I saw her name on the program, but I haven't seen her yet. I hope she makes it. Anyway, I guess I'll start out by telling you about one of my two interactions with the social work profession. So in this first one, I was a young wife in New Haven, Connecticut. My husband was at Yale Law School. There were many sort of captive wives in New Haven looking for meaningful work and things to do. And I think I was a research assistant at Yale University, which didn't pay very well. And I heard from friends like Mimi that you could take a caseworker exam at the welfare department, and you could get a job as a caseworker. It didn't matter if you ever had any social work or anything. And it paid much better, actually, than being a research assistant at Yale. So lots of my friends took that exam, and a lot of them wound up getting offers from the New Haven welfare department. I didn't get an offer, so I can only conclude that I failed the exam. I did not make the cutoff. So looking for a second best choice, I did eventually enter Yale in economics and became an economist. Let's see, let me see if this thing is working here. Which way am I supposed to point? Yeah. Okay, so let me just do my traditional thing. A little bit of advertising about IWPR. It is a think tank. Our mission is to get our stuff out and to inform the dialogue. And we have, in this administration, of course, worked closely with Tina and other members of the administration. These are the areas that we work in, and we're now 25 years old, so I just want you all to know about our celebration that'll be happening here in Washington at the AFL-CIO in just 2 months from today. And I hope you will all come. It's actually a free event. That doesn't keep you from donating, but it does not actually cost to attend. And these are the 5 major areas that we work in. You can see that poverty and income security is one of them. But I tend to work in all these areas, and so as a result, I have become expert in absolutely none of them. This is the outline for today's talk. I want to talk a little bit about the reasons for poverty overall and for the disproportionate poverty of women. The risk of having children, move on to the business cycle and how women fared in the recession and recovery and what's working there or not working, and talk a little bit about the new measurement of poverty. Then I want to focus on earnings as a long-run solution, improving earnings, and focus on some remaining barriers, especially low-paid work and care work, which is very low-paid and which is very female-dominated, and then end with some long-run policy solutions. So these are the 3 reasons I've come up with for why women are disproportionately poor. I think these surely have much to do with Diana Pierce's work. The first thing as an economist I would point out is that women earn less than men. So even if women earn, and then the second reason is that women have the children and they tend to stay with them. They don't actually leave them. And men do tend to leave them and stop helping to support them. Not all men, of course, but a fair amount, because we now have, I think, about 25% of families with children under 18 are raised by single mothers alone. So it's a fair number of men who are, leaving their responsibility. Of course, there are some choices to have children without men. I'm not, that's certainly an available option now to women, which is a sign really of women's liberation, including for very poor women, that you can have children and support them without men, I think is a form, an aspect of women's liberation. And then the third reason is that either fathers or others are not contributing enough to this family. So since poverty is measured at the family unit, you can count up how many individuals are poor, but it's always measured at the family unit. So even if women made the same amount of money as men, the very fact that they are raising children on their own and men are not would make women more poor. So they would need transfers, and then that's that third bullet. We just don't have enough money being transferred to poor families, either from individual men, or from the public sector, or from private charity. And one of the main differences between us and other advanced countries is that they do more on the third bullet. They transfer more money to these poor families. Most societies have women earning less than men, every one that I know about, but perhaps there's one I don't know about. So that's pretty common. And then to some extent, the second bullet differs a little bit between countries as well. In many countries, there is a lot of non-marriage and childbearing outside of marriage, but there are also, I think, more long-range cohabitation with men. So I think that women are not as typically completely alone in supporting the children economically. But women with children are not the only people that are poor. Older people are poor, single men are poor, married couple families are poor. And so these are just focusing on some reasons for poverty overall in the U.S. And again, I want to focus on employment. Tina Chen mentioned the importance of raising the minimum wage. Even $9 would be too low. It should be about $10.50 or something like that to bring it up to where it was once historically. I just saw a clip on the news last night of Senator Elizabeth Warren, the great Senator Warren, saying that if the minimum wage had risen with productivity, it would be $22 an hour now. And that's not really all that far-fetched, because I have learned from friends in Australia that the minimum wage there is $18. And it applies to everyone except for if you're under 21, there's a graduated thing, but by the time you get to be 21, you're making a minimum of $18 an hour in Australia. So how do these countries do it? I don't know, but I think we can do it here too. We have much less unionization and collective bargaining than we used to have. And essentially, in a market economy, what you would have to do if you didn't have any other supports, you would have to earn enough to save enough to cover all the periods of your life in which you don't earn. Because in a market economy, mostly your income is coming from wages or from a business if you should be a self-employed. So what we need then, since we don't have high enough wages to cover all those periods of non-earning, is public support. We need more public support for both working and non-working families in order to keep them out of poverty. And we do have this great thing called social insurance. My friend Ruth Brandwein already mentioned it. I was so glad that was the first question, I think, for Tina Chen. I debated Gene Sperling about it last night, and he said, "Oh, Heidi, I know well that all of you are opposed to this, but, blah, blah, blah. But if they get the chance, they're going to do it." So social insurance provides income replacement. But so far, our Social Security system really only covers three kinds of situations: retirement and long-term disability through Social Security, and unemployment through another federal program, in this case a federal-state partnership program. We do not have income replacement in general in the United States for sickness, short-term disability, or family care needs. We have made some progress on that recently. I hope everybody knows that New Jersey and California do have 6 weeks of paid family care leave now, through the expansion of their state temporary disability insurance systems. And there are 5 states, plus Puerto Rico, that have temporary disability insurance systems. So both these systems are mandatory. Every business must participate in it. In most cases, the businesses share the cost, just as with Social Security, it's a shared cost between workers and business. In some cases, it's workers only. The 2 family leave cases are being paid for by workers only in those 2 states. And there's a big movement to spread these programs to all the 50 states, and there's also a fairly big movement to force employers to give some short-term sick days. And we've just had a win on that in Connecticut. Portland, I believe, Portland City, Portland, Oregon, and Philadelphia recently. And there's a few other cities like DC, and it started in San Francisco. So, at which?
Seattle.
Seattle, right, Seattle. So we are unique among the advanced countries in not having a right to a paid sick day. And fewer than 50% of our workers in the private sector actually have even the right to one single paid sick day, which is pretty shocking and amazing. So you can imagine right there that that's a barrier, a real problem for women raising children. And eventually I'll get to another part of my story, my second interaction with the social work profession as a whole. So the fact is that we don't have these things, and that is contributing to poverty overall. Because in a market system, you need a lot of different ways to cover you when that market can't provide for you. So just to look at some poverty data, and this is using the traditional Census Bureau definition of poverty by age, and not too surprisingly then, based on what I was just saying about why women tend to be poor, the highest rates of poverty are in here, in these childbearing ages, 18 to 34 to 44, when a woman is very likely to have a child living with her. And these rates of poverty are very high. For women, 21.2% versus 15.7% for men. But they're really very high across the board. There's no other rich country that has such a high poverty rate as us, I don't believe. We also see that in old age, when women are alone again without male income because they outlive men, their poverty rates are much higher than older men's. In this area, I'm presuming that women are most likely to be married, and so the poverty rate, which as I mentioned is always computed for the family, is lower for women. This is an interesting thing that economists discovered. Even among children, 5 to 17, the poverty of boys is slightly lower than the poverty of girls. And this they have attributed to the fact that divorce is more likely when there are only girl children, or perhaps marriages are less likely to occur when there are only girl children. So I can attribute this to my wonderful profession, which most of the time I excoriate, but because it's responsible for so many bad ideas. Has only a few good ideas. And we'll see some implications of that a little bit later, but in general, very high rates of poverty for children and for the single mothers who are raising children. This one does show basically the risk of having children. I always like it when there are a lot of young women in the room because I can say that children are not good for your financial health. So here we have married couples with children. Their poverty rate is 6.5%. Without children, 3.1%. Single moms, 36.3% poor. If children, no children, 10% poverty. Single men, 18.3% poor with kids, and this only means kids under 18, and 7.4% for single men without kids. So this reflects the earnings differences between men and women, as well as the more likelihood of the presence of children among families with women. And what we've done a number of different studies on this subject over the years, and one that we did with the AFL-CIO in the late 90s was showing what would happen if we could in fact get women to have equal pay with men, similarly qualified men. So we did some regression analysis, and this report was called Equal Pay for Working Families. And we showed that if women got the same pay as similarly qualified men, poverty would fall by half or more for every group. So here's poverty of single moms. These are for families with employed women. So these poverty rates are a little lower than the ones we saw on the last chart because these are only families that had a working woman. And of course those families have a bit more income, so their poverty rates are lower to begin with. But it falls by more than half here for single moms, falls by way more than half for single women, and falls by a little bit more than half for married women. And this statistic is often quoted by Pat Shue at the Office of Federal Contract Compliance at the DOL. She says, Heidi Hartmann says the poverty rate will fall by half if women earned the same as men. And I always say, you gotta say, in a family with a working woman, we're not gonna eliminate all the poverty, but of course many families do have working women now. And also we updated it actually for the Obama administration in their first campaign, which we made available to all candidates because we are a nonpartisan think tank. We updated these numbers, so, but unfortunately I couldn't find those, so I'm giving you the old numbers, but I don't think it would change much. So now I want to take a look at a little bit of a further look at the recession, and I had a minor in economics. One minor was labor economics and the other was economic history. So I decided, when asked recently to speak about poverty, to take a look at poverty in the very long run, from when our data go back to, which is about the late 60s. And what we're looking at here is that this bottom line is the unemployment rate. 4% in 1966. You can see the business cycles are these long, gray, tall columns. There's a period of business cycle. This last one, very long business cycle, very wide, much wider than the others. And you can see unemployment going up, a kind of long-run increase in unemployment in the late 70s and 80s. Then we had some pretty good growth periods, especially the 90s, our longest boom, and unemployment fell, but still not really down to where it was. I mean, it fell to 4%, but we were actually below 4% here. And then we did pretty well in the 2000s in terms of unemployment until this recession, and now it's remaining high. The recession is over, but we haven't had, you know, a steep decrease yet. We're waiting for it. So this is unemployment, and the amazing thing to me when I looked at this, and you know, I look at numbers every day, and lots of numbers every day, and it takes a lot to stun me. This graph stunned me, because it really shows, I have to say, now this is using our standard traditional definition of poverty, how little progress we've made in all this time. We're back where we were. The blue line is men's poverty. It's a little bit lower than the red line, which is women's poverty. And the interesting thing to me is they both, from the early 70s on, they both track the business cycle extremely much. And they're pretty much the same shape. There's not a whole lot of difference in what's affecting women's and men's poverty. You see some closing here, which I think had to do with the increase in women working. This was, you know, due to the welfare, so-called welfare reform, and the EITC. Now, the EITC dollars are not counted in the poverty rate here, but just the fact that more women were working reduced their poverty. And we see in this recession that women seem to have not had their poverty increase quite as much as men did. So we see some possibly good features of the safety net, at least a part of it that we're counting here, which would be unemployment insurance, for example, in this most recent recession. In fact, I think Diana is one of the people who pointed out that unemployment insurance didn't work very well for women, and that because it doesn't work very well for low-wage workers, it doesn't work very well if you move in and out of the labor market, it doesn't work very well if you leave the labor market for a non-work-related reason, like taking care of your older mother or taking care of your child. So one of the things the Obama administration did in that stimulus package, which was very valuable for women, was to reform that and to give states bonuses if they reformed it. And you can actually see that in this recession, for the first time, women were almost as likely to get unemployment insurance as men. It was a big change. And many more states now have provisions to count all the wages of low-wage workers, allow women to collect even if they're working part-time and want to continue working part-time, allowing women to collect if they follow their husband to get a job, and so on. So, but here we do have some progress in poverty going down, even as unemployment was going up. I sort of attribute this to the war on poverty, but I don't know how accurate that is. It could be also the movement into, you know, from the agricultural rural south to the north, the continuation of that movement. But this is very sobering and depressing to me graph. But that is the nature of economics, I'm sorry to say. As you know, it is called the dismal science. We earned that legitimately, that reputation. So here, I just want to show you the new poverty measure. Finally, the logjam broke, and we have a new official poverty measure being issued by the Census Bureau, this little green line, and it's called the Supplemental Poverty Measure. It doesn't go back, they've only issued these 3 years. The NAS poverty measure, we picked a Census Bureau measure that we thought reflected that poverty measure the best. And so you can see what is happening here. Basically, the new poverty measure is higher. So the logjam in getting a new poverty measure was, you know, all the lefties saying, we want a new poverty measure because it'll show that people are more poor. And the righties saying, we want a new poverty measure to show that people are less poor because we're giving them all this federal money and all those federal grants that you don't count, because we didn't count the EITC, we don't count the cash value of food stamps in the regular measure. So what happens is that you do see that the measure is higher, and this is now poverty of men and women together, and this is the unemployment rate of men and women together. So you see it's higher, but you see it's moderating a little. It seemed to not dip as much here as the regular poverty rate, and it seemed to not rise as much here as the regular poverty rate. This new measure, for which we only have 3 years of data, it's like a different base, it's households, not families. So it would take us a while to figure out why this is moving that way. I think on the whole it's an improvement, and I think my next couple of charts, show some features of that new poverty rate. So this is about the impact of the supplemental poverty measure on measuring women's and men's poverty. It wasn't in the report, as I recall, but we had to get it somehow. And so what we see is that women's poverty goes up a little bit with the supplemental measure, but men's poverty goes up much more with the supplemental measure. What are we counting in this measure? We're counting the healthcare costs and the cost of child care. And we're counting benefits, so to the extent that women get more benefits, like more likely to get food stamps, welfare, what's left of it, EITC maybe, this would explain why the new measure, their poverty rate doesn't go up as much as men's. Men may be less likely to get some of those benefits. So what you have in this new measure is poverty is becoming more similar for different kinds of people. It's actually becoming more similar for whites and blacks, and it's becoming more similar for married people and single people. Married people because the cost of childcare are being counted. I don't have graphs for all of that, but this just shows age, for example, where we used to say that poverty rate of seniors was 10.7%, adults 15.3%, children 22.3%. With a lot of the benefits going to children, specifically families with children, their poverty drops to 17.8% in this measure. Women's increases slightly because there's an overall increase. And men's increases, older women's increases quite a lot. This whole chart is women. So it shows a more equally distributed poverty across the age ranges. Whereas, you know, the chart I showed you at first had very high poverty for children and single moms, and then lower poverty for the middle-aged, and then higher poverty for senior women, but not as high as for children. Now, looking at this last graph, the women's poverty in old age is almost the same as it is for children, female children. So here's men's poverty, which again showed very large decline as men aged. Social Security does a good job keeping men out of poverty, but when you count healthcare costs, the poverty of the aged goes up. Poverty of the middle of all the men, prime age 18 to 64 is a little higher, and of children lower. So it's just an interesting, I'm not going to go to battle for this new measure and saying it's perfect or great, but I think it probably in some ways gives a more accurate reflection of the distribution of poverty across the population. But the central message is really that, whereas a lot of people thought the new measure would solve the poverty problem, no. It doesn't solve the poverty problem. It just reflects that it's a larger problem even than we thought before. And it's distributed slightly differently. So in this next chart, let me take a look at the difference, or what helped women in this Great Recession. And this is from a study that we haven't published yet that Jeff Hayes and I are doing. And we looked only at mothers and what happened to them in the recession, whether they lost jobs and whether they became poor, and what helped them get out of poverty. And so, again, this is showing if the family had, and this is using the standard Census Bureau poverty threshold, but then we are adding all the things we can count using the CPS, EITC, the value of food stamps, and so on. So we're adding things into income here to get the poverty rate down in a way that the official rate does not do. But we're also not using the supplemental measure yet because we didn't include the child care and health care costs. So we're using the standard poverty threshold here. So this is interesting. If the family, the married couple's family, had only the mother's earnings, that family, 58% of them would be poor. Very similar to the single mother's family if they had only the single mom's earnings, 59%. So this pretty much shows you that the earnings across family type for mothers, not necessarily for all women, but for mothers are pretty similar on average. But what happens in the married couple? When we add others' earnings, generally the husband, poverty falls substantially for them, for families with children, down to 13%. We now add all the other market type income, pensions, savings, assets, investments. We get it down 1 percentage more to 12%. We now add social insurance, which is unemployment insurance, Social Security. We got it down to 11%. And it's adding the cash benefits that do the most for married women. And those are EITC, which go to low-earning families, but also the child credit. So I don't know how many of you realize that the child tax credit, which was like $1,000 per child, and that was increased during the recession, goes to about 95 to 98% of married mothers. I mean, everybody is on the dole. I was talking to Natalie Sokolov. No, Sharon from Juan told me that her students are like on a telecommuting computer course are conservative, rural, Christian from the South, older, and they don't think we should have a social welfare state. And I said, well, I'm going to send you the paper that goes with this so you can tell them that they are on welfare too. So that's pretty cool. I mean, I think that's pretty cool. And if we add in-kind benefits, SNAP, school lunch, etc., we get down housing subsidies, we get down to 5%. Now, interestingly, when we look at all of these three are what you get from the market, okay? And this is what you get from social insurance and transfers. So the transfers for married couples reduces their poverty by more than half, from 12% to 5%. That's pretty good. Now what happens with single moms? Well, they start out at the same place with just the mom's earning. They add other earnings. That does decrease their poverty rate by about 11%. We add other market income. That goes down about 5% for them. They may have more older people living with them, so they may have more pensions. I'm not sure. I have to look at exactly what that is. We add social insurance. That brings them down another 2 percentage points. Unemployment, Social Security. We then add, what's that last thing say? Cash benefits. That does a lot for them, 8 percentage points decrease. And finally, we add the non-cash benefits, school lunch, food stamps, SNAP, and we get down to 29%. Well, 29% is not half of 43. This number should be about 21, 22% if it was even doing as well for single moms as it did for married moms. So many people have pointed this out, that in the U.S. and in most countries, in many ways, the safety net does not do as much for single mothers as it does for married mothers. But in all other countries, it does better than ours. And I think it was Sheila Kammerman that worked a lot on this, and she showed that our provisions for single moms are particularly stingy, and this shows that. So this is what happened in the recession. I don't know if you noticed in that last group picture on the graph of the unemployment rate, you can see that women's unemployment rate was falling less than men's. But here I want to look at now earnings as a long-run solution. And earnings has worked very well for women as a long-run solution. So here's the happy part of the talk, okay? Have to have a happy part. How am I doing? Oh, okay. So here we have women's, here we have women's real earnings. This is thousands of dollars over here. And so they started out at, this is all women who work full-time, this is median earnings. So they started out at about $20,000 a year in 1960 in real dollars, and they're now up to almost 40,000 or 37,000 in real earnings. What happened to men? Well, they had the growth in earnings up through the early 70s, but then flattened out or decreased. Well, the earnings ratio did improve. Now, we wish it would have improved with men going up and women going up faster, but I mean, it did go up when it went up faster than men because men stood still, and that did improve the gender earnings ratio. So this is due to a lot of hard work by women. They're working more, which means more of them are working full time. They're getting more work experience. And they're also getting more education, which we'll see in another slide. So I also want to point out that this improvement of the earnings of women relative to men has happened in almost all race and ethnic groups. Now in this case, we're comparing the females to white males. So the one group was not made any progress, the Hispanic women. Black women definitely made some progress in their earnings ratio. White women made progress. You see that progress slowing down. You also see the progress for black women slowing down. And Asian American women have made progress that are still making progress. Farrad Bernstein, who worked for Vice President Biden for a while, and now he's at the Center on Budget and Policy Priorities. One year when Asian American women first started to go up above white women, we were really curious about why. And he looked into it and he said, Heidi, I see the answer. It is because Asian American women do not go into teaching. And if they went into teaching as much as white women, they would not have this big earnings gain here relative to white women. What can I say? One of my daughters is in teaching. Not my advice, but she does love it, so, you know, it's okay. So here's the progress of women in education. I mentioned that it accounts largely, not entirely. We had anti-discrimination laws, we had other things, but it's very clear that women have increased their education. This is all degrees, bachelor's and everything higher, has now increased to 49%. So this is counting law, medicine, engineering, architecture, ministry, absolutely everything. And it's, you know, pretty soon we will get over to 50. I understand we're over 50% of PhDs, but that's not all the degrees. So the tremendous progress for women, and this progress is also true for women of all racial groups. There has been, and ethnic groups, there has been an increase in education for all women. But let's take a look now at the different education levels. We saw on the whole that men's real wages are not rising and women's are. So I wanted to take a closer look at men at different levels of education. So here you have men with less than high school. Again, through the early 70s, through the mid 70s, you saw gains for all four education level groups of men. That was back when we say productivity gains in the society actually went to the workers. Now we say that's not happening anymore. And for less than high school, of which there are many fewer people than there used to be, their real wages have really taken a tumble from over $40,000 a year down to less than 30. For high school graduates, from over 50,000 down to just about 40,000. For some college, from 60,000 down to 50,000. And for college as a whole for men, although there was some increase in this range, it's still below where it was at this high point here. So it's about the same for college-educated men in terms of real earnings growth. The women, and take a look at the values of these dollars. So here you've got college-educated men at 70, for example. And then let's look at the next graph for women. Well, this shows a better picture in some ways, right? All of these lines are going up slightly, kind of. Not this one. This is the not high school grads, but again, there are fewer of those. This is high school grads, and they are pretty much the same where they were in the late 70s. Some college is a tiny bit better, maybe, but again, movement in this area just to slow down in the recession period. So that'll probably start going up again, and high school will probably go up a little bit too. But the college-educated women have done pretty well. But what's the problem? Well, $20,000 a year different. That's huge. This is even $7,000 a year different for women without high school compared to men who were getting about 27. That's can be the difference between poverty and non-poverty for your family. So these wage gaps are still important. The next graph shows you what happened to the wage ratios in these same education groups. So this line the high school dropout woman compared to the high school dropout man. In the 60s, she only made about half of what he made. Now, after all this time, she's up at about 75%, 77%. So relative to lesser educated men, the lesser educated woman has done well. The high school educated woman, same thing, her ratio fell for a while, but then started to increase. And she's up here too. Some college woman fell for a while, but then started to increase relative to some college men, and she's up here. And the college women are kind of an interesting case because, yes, they did increase relatively to men, but now nothing much happening in the last 10 years for them. So they're sort of not much progress relative to their college-educated peers. But what we see from this dispersion of where the wage ratios were for women relative to men, there's a convergence. And I think a lot of this honestly explains some of the non-marriage that we see in the low-income groups. You get less from marrying a guy relative to your own earnings than you used to get. And so I tend to explain all these things economically. I mean, that isn't fault of economists. And also, from running a nonprofit, I can tell you that cooperating is a lot more difficult than working alone. So, all these funders, they always want us to cooperate with another institution to do a great study. And we're like, well, are you going to pay us extra for all the time and effort that we have to put into cooperating? And they say, no, it should be cheaper for us. There should be economies of scale. Well, of course, there are economies of scale and living together. That's reflected in the poverty rates, which don't double when you get 2 people. But there are those costs of cooperation and of living with people. And, I think you can see a kind of long-run preference for living alone. We have a lot more people living alone at older ages, and middle ages, and in youth. So there is a cost of living with other people and cooperating. And you have to get a pretty good payback to do it. And if you don't get that payback, you might choose not to do it. So I think that's what's been going on here. Just a thought. Of course, men doing housework would be a great payback. And the data show they are doing more. And actually, a shocking thing I just noticed in the data, compared to our comparable European countries, men in America spend more time on childcare than men in other countries, relative to the time that women are spending on childcare. So we actually have more equal work hours in America for women and men, either wage work and non-wage work, than women and men in other countries. We're virtually the most equal in that regard. We're a very high-work society, and therefore, because we have so much wage work, we don't have as much unpaid work. And that's one thing that helps the men catch up, because women are doing less unpaid work than in some other countries where they work for pay less. But I think we have some movements toward equity, which, women in other countries still look to us for gains in that regard. What I want to take a look now at this wage problem that we've seen here. We've gotten up to here, and we haven't gotten much further in the last few years. So let's just take a look at the whole economy, where the jobs are. And we divided all the jobs into male-dominated, 75% or more male, mixed occupations, between 25 and 75%, and female-dominated occupations, more than 75% female. And here are these wage differences I was talking about. So this is almost $10,000 a year. If you can get from this female-dominated occupation to a male-dominated occupation on low skill, you can improve your wages by almost $10,000. And the wage ratio from this column to this column is 74%. And this is a wage ratio that has everybody in it, so men and women who work here compared to men and women who work here. Medium-skilled jobs are the most equal. These are jobs characterized by civil service, by unions, skilled trades, police, fire. If you can get up in here, you do gain, but you have better pay equity in this middle range. Why don't you have this good pay equity in the high-skilled range? Well, because there's no limit on the top. There's some very, very high-earning men. There's some high-earning women, We've heard a lot from them recently, Marissa Meyer, the lean-in woman, Sheryl Sandberg. So there are high-earning women, but a lot more high-earning men. And look how much you could gain if you could move from the high-skilled female-dominated to the high-skilled, male-dominated. That's a huge gain of 50% basically, right? You get 50% more if you move from here to here. About 500 a week or 25,000 a year. Is that right? I don't know, something like that. And there are not as many women in these female-dominated occupations. There is a tendency to want to get into integrated or male-dominated occupations. So let me take a further look at what these low-skilled female-dominated occupations are, and I'll read them for you because I know this is small. So this is from a different study we did where we defined every occupation as low wage if a third of the people earned less than $9.28, which in that time period, the early 2000s, was, if you earned that full-time year-round, you would be at the poverty level for a family of 4. So here are the care-related, female-dominated low-wage jobs: nursing, psychiatric, and home health aides, child care workers, teacher assistants, personal and home care aides, and preschool and kindergarten teachers. We put them in there because we consider preschool caregiving also. And they're 88 to 98% female, these caregiving jobs. And they're very low wage. And here we have non-care related. These are also low wage, but we have cashiers, which is the most integrated one, only 77% female. Maids and housekeeping, cleaners, receptionists and information clerks, medical assistants and other healthcare support, hairdressers, stylists, cosmetologists. And here we have some integrated occupations. I just listed them. They're at least 24% male and female. Waiters, waitresses, retail salespeople, cooks, janitors, food prep, stock clerks, managers of food prep, packagers, and dining room attendants. And what are the male-dominated occupations that are low wage? Well, first of all, there's only 4 of them.
Wow.
Laborers and freight stock and material movers, miscellaneous agricultural workers, security guards, and gaming surveillance officers. I'm really interested that that's a title, but now we're getting more and more gaming, right? Maryland's got tons of casinos now, and ground maintenance workers. So most of these low-wage jobs are either female-dominated or integrated jobs, and they pay very, very low wages. So I think that, you know, we're seeing a push in society through the Caring Across Generations campaign and others to try to really raise the wages of these caregiving jobs. Many of them have public paid. They're paid by the public, Medicaid, Medicare, public school districts, and therefore we can use, you know, political pressure to try to raise the wages. Obviously, not a good time now fiscally for state and local governments, but as an economist, I hope eventually we'll see another boom. I don't know when it'll be, but we will see another one. So I just want to wrap up with, you know, what some policy recommendations would be to solve this really long-run problem of poverty in America. We have some that are, so these are some of the public programs, and these are all means tested, and I just indicated which are cash, which are non-cash. I don't know, do you think the SNAP name is going to stick? Anyway, SNAP, food stamps, Medicaid, welfare, Pell Grants, which Tina mentioned, subsidized child care, subsidized housing. And then some other programs very important to help poor and low-income women are the universal ones, Medicare and Social Security, unemployment insurance, and as I mentioned, these recent reforms really did help low-income women get that. But I wanted to focus really on the safety net as what we would need to do. I think increased cash welfare. One of the things we found in that study that Jeff Hayes and I did is that AFDC, well, what we used to call AFDC, TANF, didn't increase hardly at all in the recession. So we should have more cash welfare. I mean, when I tell people that when I was a young wife in New Haven, there were wives whose husbands abandoned them. It was after all the age of Aquarius and all that, if you remember. And they went down to the welfare office and they could get money. And across the table from them were their friends in the women's liberation movement, the ones who passed the test. You know, it was universal. I mean, at least in the North where we were, it was universal. You could just go down there and get it. We could strengthen Social Security for women, those older single women who are poor. They are that way because they earn less and because they took a lot of time out of the labor market, and we could give them caregiving credits for that time out of the labor market to do caregiving, and that would boost their benefits. We should consider, I think, a basic income grant. If we're not getting productivity growth going to people Then we could do things like give everybody a basic income grant, have a negative income tax, so not just an earned income tax credit, but something that would work for everyone, not just in the categories that the earned income tax credit covers. I think new social insurance to meet these life cycle needs, paid family leave. This is the single one I think would be the most important. These are also important. And this, of course, is very expensive. So if we could do this would probably in dollar terms equal more than this. By doing this, these two things would keep so many people from falling down into poverty. People that are making it on their own just have a crash when they get an illness or family leave. So I do have one more slide. I'm going to end though with my closing story about my interaction with the social work profession. Bringing up the labor market, we do need equal pay and EEO enforcement. We need collective bargaining. We need a much higher minimum wage. And we should do more to help people find higher paying occupations, to get women out of that female ghetto, or to have pay equity, comparable worth, so we could pay those female-dominated occupations what they deserve. But turning back here for a moment, because I know I'm over time. So my mom, whose husband was a gambler, she was a German immigrant, as was he. And so when I was about 4, she realized after he forged some bank loans in order to gamble more, she realized she couldn't survive with him, so she divorced him. She never went beyond high school, which was in Switzerland, and she never learned to type. And so typing actually is a great skill, and clerical wages are higher. If you don't have those skills, you're going to be a retail worker or a house cleaner or something like that. And so she was a retail worker. She had just started this job, and she was laid off on Christmas Eve from WT Grant. I don't know if they're still in the 5 and 10 business. Laid off on Christmas Eve, wound up in the hospital with something like a gallbladder attack, had to have her gallbladder out. My brother and I, I was 13, my brother was a little older. We were shipped off to, live with friends because my mom was in the hospital. Nobody was going to leave us alone in the house. And as my mom got out of the hospital, she had no means of support because you can't collect unemployment if you were sick, not able to work. And so she figured, after all this time, she would have to go on welfare. And she basically begged my brother and me to go down to the welfare office like every day after school. The junior high was about 2 blocks from the welfare office. And I don't know if my brother ever went, but I could just barely make myself go. My mother, every day I come home, Heidi, have you been to the welfare office? Well, what was so important about me going to the welfare office? She said, well, the caseworker wants to meet the whole family. So I went, and I met with the caseworker, and I thought he was a middle-aged guy with a paunch. I remember he was in a sweater. I had to walk upstairs to his office. And one of the questions he asked me was, how did I do at school? And I was a very modest person then. I'm also extremely shy. And I said, oh, I do pretty good at school. And he said, well, what's good? You mean D? I said, no, pretty good. C? No, pretty good. And, well, what do you get? And I said, well, I have all A's. And, and as my brother did too. And, I just remember that as the kind of bias that even well-meaning people might have against poor people. You just assume they're not very smart. It's not because they're not smart that they're poor. And I've always remembered that. And we actually didn't wind up going on welfare. I don't know what the reason is, but as I reviewed that scene in my mind later, I realized that that middle-aged guy with the paunch was probably about 25.